Not everyone can walk into a blood donor clinic, answer a few questions, and just roll up their sleeve.
We need to rectify this.
Even with tests proving his blood was safe, Christopher Karras was rejected.
Just because their questionnaire said that queer people weren't able to donate.
He's filed a human rights complaint against Canadian Blood Services and Health Canada, claiming discrimination. Gay men were banned from donating blood in the 80s due to widespread concern over HIV. With advances in blood testing, the rules changed 5 years ago. Gay men can now donate blood, but only if they haven't had sex for 1 year.
There was no evidence to support the policy in the first place, but there was also no evidence to support the lowering of the policy. So this policy hasn't been based in science either way.
Based on a presentation to stakeholder groups, Canadian Blood Services may soon be asking Health Canada to approve lowering the no-sex policy for gay men to 3 months by spring of 2019.
People are concerned that this is discrimination.
Dr. Mel Karajan is working with Canadian Blood Services to find a more balanced approach to screening donors. He says the real danger to the blood supply isn't from the viruses we know about.
The concern is having a new agent introduced into a population where there's high-risk activity and that can be spread very rapidly.
What's key, he says, is separating low-risk men who are in stable relationships from those who are having risky, unprotected sex with multiple partners.
There's major efforts to try and allow donations as long as they're safe.
But even this blood donor watchdog group points out it's being done. Italy and Mexico have adopted risk assessment policies based on individual behavior with rigorous screening questionnaires.
It's been proven now in other countries, when those deferral periods have been lifted, that you can still manage a safe blood system.
Your goal is to have the policy eliminated.
Yes.
Karras says he just wants to be treated like any other Canadian who wants to donate blood. Christine Birak, CBC News, Toronto.
It's worth noting the Liberals promised to end what they called a discriminatory ban back in 2015. The Prime Minister expressed disappointment when the deferral period was shortened but not eliminated a year later. As for the current screening process, all first-time blood donors have to fill out a questionnaire covering things like medical and travel history. And after the donation is complete, the blood itself is screened for a handful of diseases like HIV, hepatitis B and C, and syphilis.